Hi, I'm Ruchi Gupta. I'm a pediatrician and researcher and director of the Center for Food Allergy and Asthma Research in Chicago, Illinois. I'm here today to talk to you about an exciting new initiative, the SEED study, Start Eating Early Diet, partnering with FAIR to develop a comprehensive prevention campaign. Now, this campaign has 4 components. First is the clinical study. This is a large clinical study of 2,000 infants where multiple foods, which I will get into later, will be introduced early in life to see if we can prevent multiple food allergies. An education campaign with evidence-based and patient-centered insights and resources to make early introduction feasible for all new parents. Awareness, pediatrician-directed campaign that emphasizes integrating early introduction and food allergy prevention best practices into every well-child infant visit, especially at the 4 and 6 month. And advocacy. FAIR established public-private partnerships guided by research and education, pushing multi-allergen early introduction into the 2025 U.S. Dietary Guidelines for Americans, the DGA. What do we know about the epidemiology? So 32 million Americans are impacted by food allergy, about 1 in 10 adults, and 1 in 13 children. What we found in this study was that over 42% have experienced a severe allergic reaction, and many have multiple food allergies. Now for children, the top 9 foods, as we know, are peanut, milk, shellfish, tree nut, egg, finfish, wheat, soy, and sesame. And again, we found a prevalence of about 7.6% for convincing food allergy, and overall physician-diagnosed food allergy was about 5%. Of course, food allergies vary depending on the age of the child. Young infants or young children, the top allergen is milk. Milk covers about half of all food allergies at that young 1 to 2 age group, and then starts to decrease as children get older. However, even into teen years, the prevalence of milk allergy was about 16% of all children with food allergies. Now, we all know peanut to be one of the highest, but then the others are also considerably high. And there are differences, like we said, by age, with milk and egg and wheat and soy being higher in those younger age brackets. With adults, we still see the same top 9, but the order is different. It's changed now. So it's shellfish, milk, peanut, tree nut, finfish, wheat, egg, soy, and sesame. For adults, the convincing food allergy prevalence was about 10.8%, and the overall physician-diagnosed food allergy prevalence was again around 5%. Early introduction. This is nothing new, but as we know, there's been a ton of research out of London. The first study, which really just was observational and finding that children in Israel had much lower rates of peanut allergy than children in the UK. This was, I think, the first study to prompt the early introduction campaign. And what they really found was that the prevalence of peanut allergy in the UK was 1.85% compared to in Israel at 0.17%. And the magic ingredient was the bamba that was fed to infants in Israel. So early consumption of peanuts in infancy became associated with a low prevalence of peanut allergy. And this was again done by George Dutoit and Gideon Lack. To follow was the seminal paper, the LEAP study, published in the New England Journal of Medicine in February of 2015. And this was a randomized trial of peanut consumption in infants at high risk for peanut allergy. I will go through this fast because I think everybody is familiar with this very important study. But basically, of high-risk infants, those who did consume peanut products had an 80% reduction in the development of peanut allergy. This number was so significant that it really did change guidelines everywhere, including in the United States. So in the United States, the American Academy of Pediatrics in the year 2000 put out guidelines saying that children should avoid peanuts until age 3, and this was probably due to the increasing rates of peanut allergy and a little bit of fear of what could happen in those infants. But then in 2008, these recommendations were revised because there was no data to show that avoiding it is beneficial. So in 2008, they were revised to say do whatever you want. But there was no research one way or the other. Now, after the LEAP study came out in 2015, in 2017, the NIAID put together a committee which came up with new recommendations in the United States for early introduction of peanut products. These were the Addendum Guidelines for the Prevention of Peanut Allergy, and they were published in January of 2017. I'm going to talk about one more study, a very prominent study, the EAT study, Enquiring about Tolerance study. This was a randomized controlled trial in the UK where exclusively breastfed infants, 1,300 of them from the general population, were enrolled at 3 months of age and randomly assigned to the early introduction or the standard introduction groups. Early introduction was with 6 foods: peanut, egg, cow's milk, sesame, fish, and wheat. Standard introduction was exclusive breastfeeding until 6 months of age per UK guidelines. In this study, infants were enrolled, like we said, at 3 months. The intervention went 3 months to 6 months. Then there was a follow-up period at 12 months, and final outcomes were at 36 months. The portions that they were supposed to achieve seemed to be a little bit difficult for families of the cow's milk, peanut, fish, sesame, egg, and wheat. And I have a table that shows exactly what they were providing or encouraging infants to consume. What did the study find? And this is very brief. It is a very detailed and extensive study, but the intent to treat analysis was not significant. 20% reduction in food allergy prevalence in this early introduction group, but it did not achieve significance. Now, the per protocol analysis, however, was significant, and there was a 67% reduction in food allergy prevalence in that early introduction group. And specifically, it was a reduction in egg allergy prevalence and the peanut as well. Some of the limitations of the EAT study included the adherence rate. So adherence to the diet with all 6 foods, only 43% of participants in the intervention group were able to achieve that adherence. And then again, food introduction at 3 months. Many 3-month-olds are not developmentally ready for solids. It did not include tree nut introduction. And then there was a lack of racial and ethnic diversity, and it was only with breastfed infants. It was a very impressive study that taught us a lot, and we want to build off of the EAT study and learn from their experiences, and that is what we're planning on doing in the SEED study. Now, for the SEED study, we are going to utilize and leverage another study we have, which is the iReach study, which is a UO1 from the NIH to improve guideline adherence among pediatricians for the current peanut allergy guidelines. The plan for the SEED study, phase 1, is a qualitative interviews and quantitative surveys of parents. We have an understanding of what pediatricians are currently doing, and we also have an understanding of what allergists are doing. And both of these papers have been published. However, what are parents doing? There are a couple of studies in the US around parent populations. Our goal is to enroll 4,000 diverse parents across the United States to understand their current practices around food introduction in general, and then specific to allergenic foods that we're interested in including. That'll be phase 1, and that's actually happening right now. We should have results of that before the end of the year. Phase 2 will be a randomized controlled trial comparing introduction of multiple common allergenic foods versus standard of care. And again, a large diverse sample of infants starting in the US and Chicago, and then hopefully moving to some other centers, FCN centers across the US. Initially, we're going to start with 2,000 infants. We're going to start at age 4 to 6 months. We'll have 1,000 in the intervention arm and 1,000 in the control. We are looking to evaluate right now peanut, egg, cashew, walnut, almond, cow's milk, sesame, and soy. Again, this is a study that is taking shape right now as we speak. So I encourage anyone interested, please contact us. We'd love to have your input, and we're building a team right now as well as an advisory committee. So if you have any interest in that, we would love to pull in FCN participation. Primary outcome, again, is the development of one of these food allergies by age 3, and the secondary outcome is development of any aforementioned specific food allergies by age 3. For the sake of time, I'm not getting into too much detail, but I do have slides talking about the first qualitative study, which is pretty much done at this point, where we interviewed about 20 caregivers to assess their current allergen introduction barriers and needs, and then they also evaluated the survey to refine that survey that is currently in the process of launching across the U.S. We will go through the AmeriSpeak National Panel with, again, the goal of getting 4,000 representative caregivers across the U.S. Data from these studies will then enhance the study design to maximize adherence and provide valuable insight during the development of educational materials when we start the SEED study, the multi-food introduction study. Phase 2, we're going to recruit again from the NIH-funded iReach Clinical Network, and we'll make sure that caregivers represent different socioeconomic and racial backgrounds. The allergenic foods, again, that we are introducing, currently the list includes peanut, egg, cashew, walnut, almond, cow's milk, sesame, and soy. Allergenic food quantities, how many grams, will be based on published literature and expert panel of allergists. We are already engaging, and again, I welcome anyone who's interested in your participation in this study, as we do want to make it, again, a seminal study that can hopefully prove that multi-food introduction may be beneficial in preventing multiple food allergies. The baseline, within the additional methodology, we'll have baseline surveys for control and intervention groups. Control groups will receive standard of care education on food introduction for their pediatrician's guidance. They will complete weekly food diaries along with the intervention group. Intervention group will receive educational materials, study procedures, early food introduction calendar, and monthly food boxes. So learning from the EAT study, we are planning on sending them out, giving them a couple of options, and sending them out food boxes with the specified amounts and instructions for feeding their infants weekly with the allergenic foods. We are also going to stay in very close contact with them to ensure that they are able to do this. We are planning the testing strategy for these infants right now, again with our expert panel, to see when and how we should test over the 3-year time period. So timeline, we are finalizing the protocol, so definitely again welcome anyone's participation who wants to be part of this study. We hope to finalize that protocol in the next 1 to 2 months, submit to the IRB, and get approval by the end of the year to really initiate the study. We will do a pilot phase first with the foods and the food boxes to make sure they are acceptable and tolerable to families, and then we will initiate the full-scale study. Our goals: to establish a foundation of dedicated evidence-based educational resources and trainings on early introduction of new U.S. parents and pediatricians, increase the number of U.S. pediatricians who are speaking to families about early introduction by 25%, increase acceptance of the LEAP findings in multi-allergen early introduction by parents, inclusion of multi-allergen early introduction in the 2025 U.S. Dietary Guidelines for Americans, and inclusion of multi-allergen early introduction in the American Academy of Pediatrics and NIAID clinical guidelines once our results are finalized. The SEED study goal is education, awareness, and advocacy. So a strong marketing campaign to increase awareness of early introduction to caregivers and families, including launching Babies First microsite, which is dedicated to educating new parents on the benefits of early introduction, working with the Academy of Nutrition Dietetics on a new set of food allergy guidelines to cover multi-allergen introduction, and publish an undergraduate level textbook that will review early introduction and direct readers to e-learning opportunities. Launch online courses and trainings for registered dietitian nutritionists and pediatricians that highlight early introduction, and build consensus among advocacy and professional organizations on the importance of early introduction. And then I did want, if you haven't seen the babiesfirst.org, it is a work in progress, but more and more information is being added. This is a great resource for caregivers, really taking them through the process of early introduction. And again, anyone has any insights or suggestions or wants to be a part of this, please do contact us, as we really want to engage all FCNs and all partners who have an interest in this. I think that's it. I want to end with, together we can continue to accelerate life-changing and life-improving work. And I appreciate your time for being here. and listening to this. And again, look forward to your questions and participation if interested in this study. Thank you so much.